And I call this the numbers panel. I really like to put together a panel that gives you the big picture. It gives you the picture of what's hot, what's not, how the market is going, how it's going to rise over the years, what the predictions are, and we have 4 great thought leaders here up on stage who have all looked in this area, and they're going to be looking at their crystal ball today and telling you, as developers, as retailers, as professionals in healthcare, what the market segments are going to look like ahead. And so at this point, it is my honor to introduce to you Jonathan Linkous. And Jonathan is the Executive Director of the American Telemedicine Association. And the ATA, or American Telemedicine Association, is the largest membership-based organization in the world focused exclusively on providing health and medical care through telecommunications technology. And you know how important telecommunications technology is today. I'm sure years ago it was a struggle because technology wasn't available, and it was very expensive to try to move health data back and forth through the airwaves, through the wires. But today it's a very large membership organization, and the ATA annual meeting, which was here in the last one, it was in Las Vegas, right? It is the largest, it is the fastest growing trade show in the country. So you can see where the focus is going to be. So at this point, you don't want to hear from me. I'm going to turn the stage over to Jonathan Linkous, who will now conduct this panel. Thank you. Thank you, John.
Thanks, Susan. Thank you very much. Thanks, Susan. And we've got a great panel here, and I'm going to learn a lot. So I'm really looking forward to it. I'm going to make a couple of comments, first of all, just to poison the waters a little bit for you guys, just try to do what I can do. About 20-some years ago, I guess, I don't know how long it's been, but I was CEO of the National Association of Variations on Aging, and we put together something. I created something called the Elder Care Hotline, or Elder Care Locator, so people who are at a long distance could connect to their community services for their parent who might be living in another part of the country. And the idea we had was to work with networking up all the different community services across the country into this global network, and then to work that with some of the adaptive devices that were coming on board. And I had a partnership with a guy named Horace Dietz, who was the CEO of AARP at the time, and we really had this vision that, man, this was the thing to do, and this is going to come, and 20 years later, we're still kind of working on it. So if you know in sci-fi programs where, often in the beginning there'll be a guy on a farm or in a rural area who suddenly hear this kind of a thump, 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 and it starts getting louder and starts getting really shaking the windows, and everybody's looking around and don't know what's going on. That's kind of how telemedicine and trying to how chronic care and digital health is right now. There's this whole roar of stuff that's going on, and you can kind of hear it, but what's happening and where it's going, we don't really know. The ATA annual meeting, we had this year was 100,000 square feet of exhibit space. Next year it's 200,000 square feet of exhibit space. So we know there's a lot of noise going on, and there's a lot of thumping. But where it's going, we don't know. In Washington, there's a lot of hype. There's, who knows, Washington, a lot of hype. And there's a lot of money being thrown around. What's going to happen is another good question. And technological innovation, there's, M-Health. You can see it here at the Consumer Health Program for consumer health care. There's all these things for digital phones in the hospitals. There's remote ICU applications that are really big and coming on strong. There's outsourced radiology that most hospitals are doing these days. So it's really kind of booming, but what's really going to happen, what's going to be the end? For those in healthcare, you might remember from many years ago something called a Community Health Information Network. It's a wonderful idea, not to be confused with a Rio, that came and went. It's in a history book somewhere. There was something called the health.com revolution. Those of you may have been employed at one point in some parts of California working on the health.com revolution. It came and went. But where is it now? And where is it going to go? And so all of this stuff that you're hearing, all this hype, all this wonderful stuff that we're now getting money and talking about and holding conferences on. The good question is where it's going to go. So I'm glad 3 people here are going to actually definitively tell us what's going to happen. And I'm really looking forward to hearing all that, guys. Not to set you up or anything, I would never do that. So with that, let me introduce the first of the 3 panelists, Zachary Bujnoch, when I'm told that whatever I do with the pronunciation, I'm going to be really in good shape because your family does it differently too. So I'm really glad to hear that. Zach's with Frost & Sullivan, which is a very large, very well-respected firm. He's an industry analyst serving the North America healthcare practice, and he focuses on patient monitoring and analyzing emerging trends, technologies, and market dynamics in a patient monitoring industry in North America. What a great place to start off. So, Zach, if you could start.
Hello, everyone. Let me try to pull up the slides here. All right. So, real challenge I had in being asked to come here and talk to everyone today was trying to figure out how I could convey anything of significance in 5 to 10 minutes. And in this, I spend hours and hours talking to people, the same people, you know, on the same topics, and it's a very, very complex space. There we go. First slide here, I really just wanted to convey just what I said. Telemedicine is very, very complex. The middle kind of gray bullets there really are the core of this slide. They show kind of even though these systems are very, very complex and customizable, they really follow a similar path. You collect the information through some sort of peripheral vital signs device or whatever. You have a data hub that collects the device, kind of like a router almost, or is integrated with the router, and then you have the data transmission, which puts it into some sort of information transfer, and then you have data management servers and such to actually package the data and do what you want with it. And then the 5th part is information review. On the left side and the right side, you have, going along with these 5 steps, the various technology and stakeholders that are in there. And as you can see, it's a lot of people. You have people that have never really worked together, you know, outside of their core competencies. And a lot of times in the past, we've had healthcare companies trying to do all of these. And they've done a pretty good job at it, but as you can tell by all the people that are involved nowadays, there's core competencies in every one of these categories. And they're starting to work together through things like the Continual Alliance to really create a system that was completely unavailable before. Here's a slide I really wanted to spend most of my time on today. As you can tell, no numbers on it, so I didn't mean to disappoint, but when discussing with companies and such, this is the slide that I use to really get the conversation going about what they want to do with their business strategy. Just to explain it really quick, it's clinical versus wellness. Clinical, as a definition on the top, is what we traditionally think of healthcare. People are very sick, you're diagnosed, doctors and nurses are involved. It's focused around doctors and nurses. They're the people making the buying decisions. People are thought of as patients in this world more than customers. At the bottom is already well established too, which is wellness healthcare. These are things that we pay for. At the top is things that Medicare typically pays for. And it's things like thermometers, things you buy in your pharmacy, and also pedometers, scales, treadmills, things that you keep up your wellness with and you pay for. And by my wonderful little excerpts on the sides, the top portion, the bottom portion are already addressed by traditional models in the U.S. and around the world. You know, it's everything in the middle that really is where all the questions are. The first question, of course, is how are we going to pay for this? Who's going to pay for this? There's a lot of the companies that are here that are trying to figure out, especially in Continual Alliance, that's where the opportunity is. And also to explain the wonderful triangles really quick, it's simply the blue triangle is the number of customers that are potential in that base, and then the tan triangle is the cost. And so, as you can tell, there's money all over the place in the end, but in the middle is the area where we don't know how we're going to do that payment strategy. We don't know even basic business strategy around that. It's very